I'm Lewis Elliott. I'm a lecturer in Environment and Public Health at the University of Exeter. And in BlueHealth, I've been responsible for the delivery and analysis of the BlueHealth International Survey. So when we began this survey, we were only intending to recruit 10,000 people across Europe. But as we got talking to our colleagues across universities around the world, more and more people got interested. And in the end, we recruited around 19,000 people across the world over the course of an entire year. So that gives us a really rich and big data set that we can use to think about how blue spaces can affect public health and well-being across the globe. So some of the things we're interested in asking, of course, was about people's health and well-being generally, but also uniquely about their visits to blue spaces, who they went with, the activities they undertook, how long they spent there, what kinds of environments they encountered, and all of that gives us a real rich insight into these kinds of visits to blue spaces and how they affect health. So one of the logistical challenges is how you recruit many people across the world. So one of the things we did was hire a market research company, and they have ready access to panels of people from all countries around the globe. That really helped us access people quickly. One of the other challenges is with translation, especially translation of concepts like nature and like well-being. So one of the real challenges was how you get the semantics of those concepts that we understand in English applicable to all of the languages that we needed to get in the BlueHealth International Survey. So some of the headline findings that we're discovering relate to how close people live to blue spaces and how often they visit them. And we're finding that those kinds of things positively impact public health and well-being. One of the highlight findings for me relates to an analysis we've done with people with common mental health disorders. It seems that some of their experiences of those natural environments might be undermined. So that calls into question whether we should be pushing people with these kinds of health conditions to visit nature more generally. But that's just the tip of the iceberg, really. There's going to be lots more papers that are released down the line relating to these kinds of different questions.